Well, in this week's Cardiology Countdown, we have a very nice review article on cancer treatment drugs and the heart. Also, a careful look at a complication of Tavr and the new focused update for the unstable angina non-STEMI guideline. So first up is a terrific review article on different cancer drugs and their effects on the heart. This is a very comprehensive look at all the different ones. We often think of doxorubicin and cardiac dysfunction, but there are multiple different types of cardiac complications that different drugs can have, including heart failure, but also hypertension, vasospasm, and also prolongation of QT and dysrhythmias. And so this review looks at these two broad categories of some reversible and some irreversible complications, how to diagnose them, look for early warning signs, and then what therapies to institute. So it's a very important area and a growing part of our cardiology practice that we see often in consultation. And so a very nice reference to turn to in the European Heart Journal. Next up is a paper published in Circulation that looks at the complication of developing left bundle branch block following Tavr. Now, this is something that's drawn from a European registry that had 679 patients, interestingly about evenly split between the Medtronic core valve system and the Edwards Sapient valve. And they found that about a third of patients developed left bundle branch block following Tavr. They noticed this was a difference in the type where the Medtronic core valve had nearly 50% of patients and just 12% of the Edwards Sapient valve. They cautioned, and the editorialists, Fred Welth and colleagues from here at the Brigham, note that this isn't a head-to-head comparison, and so one can't draw too many conclusions there. But the risk of mortality appeared about 50% higher in those who did develop left bundle branch block. Now, this could be an arrhythmia type thing or potentially some dysynchrony of the ventricles, not fully elucidated here, but does call attention to this as an important complication to look for and try and evolve management therein. The number one pick this week is the focused update of the unstable angina non-STEMI guideline. This is an update that incorporates the second of the two new P2Y12 inhibitors. It adds ticagrelor, and prasugrel is the other alternative that's listed to clopidogrel. It notes that while prasugrel is approved for use in patients who have undergone PCI, that ticagrelor can be used in unstable angina and non-STEMI patients managed medically or those going to PCI, and was started in the emergency department, so it can be started early. They do also note that low-dose aspirin has preference to higher doses of aspirin, largely to try and avoid bleeding, and that actually is necessary when using with ticagrelor. They point out also that the triple therapy with warfarin continues to be a difficult area where there's increased bleeding, and one should target a lower INR range for those patients. And as such, I think a very useful update to bring all of the guidelines in sync and incorporate the newest therapies. So for this week's Cardiology Countdown, I'm Chris Cannon.